Hi everyone, welcome to ResearchMD.com. My name is Dr. Pramil. I work as a Chief Medical Officer and Associate Professor of Medicine in one of the large medical schools in the United States. So we're going to continue our lecture series. Today we're going to talk about a very important herbal medication and its complications, ginseng. Okay. Now, the whole purpose of this presentation is not to put the herbal medications down. But it's important to know, like every drug, herbal medication also can have complications, correct? And you need to recognize it as a physician, as a patient, if you're taking herbal medicine. And, some of the complications can develop. You have to think, okay, maybe this drug is causing the complication. That's the purpose. So let's start. Okay, yeah, when you talk about ginseng, it's a herbal medication, mainly used in the Asian countries, but it's also in the United States, also the popularity has been going up. You got a lot of beneficial effects: antioxidant, antibacterial, anti-inflammatory, and it decreases fatigue, and it also has some sexual benefits as an aphrodisiac. Now, it contains, the main product is ginsenosides, okay? This is the main product in there. And then when we talk about, let's look at, some of what we did was, we went back and did a lot of literature research and found the scientific studies. All our presentations is completely scientific, okay? If there's no scientific study behind it, we will not present it. So this study was actually published in Medicine Journal, Safety of Ginseng. That's what they look at it, and the author is Suk Kim. Now let's find out what they found out in this thing. Okay, many complications they have found. Mainly the gastrointestinal symptoms are very common, like diarrhea, nausea, vomiting. You can have decreased blood sugar. You can have decreased heart rate. You can have nosebleed. You can have palpitation. You can have nasopharyngitis. You can have eczema, anal bleeding, voice disorder, cold allergies, pruritus, rash, increased blood pressure, and insomnia, you cannot sleep at night, and bleeding, vaginal bleeding also noted. So be careful about this because of the effect of it increases the estrogen, and you can have vaginal mucosa is affected, and it can cause vaginal bleeding. Okay, now. It also found out you can ophthalmoplegia, a pain in the eye. You can have perianal pain, anal bleeding was noted. You can have increased appetite. You can have arthritis. You can have fever, and some complications like palmar sweating is also noted. And in male, it can cause gynecomastia symptoms were noted. Okay. Another study was looked at the safety assessment of ginseng, and let's find out what we found out in that study. In that study, when they looked at it, they found that it can cause increased sleepiness, dizziness. Can cause. Remember, in the other study, they found out increased blood pressure. In this study, they also found it can decrease the blood pressure. Also, it can cause mania. There's some case report people taking mania, which we'll talk about later on. Vaginal bleeding and mastalgia, which means can have breast pain, and you can have morning diarrhea was also noted in this people. Dizziness and hypertonia, the muscle become more tone, increased tone of the muscles also kind of noted. Another study published in the Journal of Ginseng Research by Choi, and they also said gastrointestinal symptoms diarrhea, nausea, vomiting is common. You can have urinary tract infection. It also noted have kidney stones also noted in that study. Okay, another study was published by Dr. Lee. It can gastrointestinal symptoms came up, and it can also cause blood sugar, you can have hypoglycemia, insomnia, headache, and chest pain, shortness of breath. Those are the complications in that study was kind of reported. Okay, now. Journal of Public Health also have a study looking at the complications of ginseng, and what they found again, it can cause high blood pressure, insomnia. There's a lot of reports about insomnia, nervousness, and swelling of the breast, and you can also have gastric symptoms also, very common in that case. Okay, now let's look at what we did. Let's look at some unusual causes, and how do we look at the unusual causes? We went back and looked at the case reports, what is in the scientific literature literature somebody said about some, they usually report the case reports. Now, one of the case report, the first one they looked at and they found out about it can cause like increased liver function tests or increased liver enzymes, but it was probably an interaction with another drug they were taking. Okay, another study looked at it and they said it can cause bradyarrhythmia. In that study, what they found out, there was like one report of it can cause like atrial fibrillation. Okay. The next study, it was somebody was taking around, I think, 600 milligrams, and the patient came into the emergence with a manic episode, like nervousness, agitation, and all that. It can also cause like dyskinesia symptoms reported in one of the case studies, abnormal movement of the neck, and another study kind of looked at it, and you have to be very careful if you're taking like a blood thinner. It can make the effectiveness of the other drug go down, or can you also make like bleeding episodes can happen. Also, and there was reports about vaginal bleeding, which we talk about because of the increased effect of estrogen. There are many reports about like vaginal bleeding because vaginal mucosa get exposed to increased estrogen, and vaginal bleeding can happen in these patients. Okay, now overall, ginseng have like a lot of complications. It can happen. It's very important to recognize these complications, and if you are taking any of those drugs, if you notice any of this complication, you may want to think maybe it's kind of related to the product like ginseng is kind of is taking. Now, there's no information about pregnancy and lactation is not much information, so at this point it's not a good idea. I would not recommend anyone take any of the herbal medication during the pregnancy and lactation. Please don't do it. Okay, thanks so much for watching. We'll be back with another presentation. Please subscribe to our channel. Greatly appreciate. Without your support we cannot continue this. God bless.